Hi everybody, welcome to my YouTube channel. Hope you're all doing well wherever you are. This movie's just to make a wrap up of the last previous three movies. Anyway, I'll dive straight into this. I want you to meet the board of Westmead WSLHD board members appointed by the New South Wales Minister for Health, Brad Hazzard, hand-picked by Brad Hazzard and Premier Berejiklian for a term of up to 4 years. The responsibilities of the board and chief executive include improving local patient and population health outcomes and responding to issues which they don't respond, obviously, from the last three movies. Delivering services and monitoring the performance of WSLHD against measures in the local government service agreement, including an agreeing a budget, a very tight budget on an annual strategic and operating plans. Very tight budget, unlike Gladys and Brad's Royal North Shore Public Hospital, where we got a pipeline straight down to Canberra. The Health Minister Greg Hunt and their local Liberal member at North Sydney, Trent Zimmerman. So yes, again, it's Northmead Public Hospital. It's like a 5-star hotel, and Westmead Public Hospital is the exact opposite. Anyway, ensuring services are provided efficiently and responsibly. Well, no, that's not happening. These people know it's not happening. They're not responding to patients' complaints. This dying man who requested medicinal cannabis, made a formal complaint, just fobbed off. No, go fobbed off. Anyway, production of annual reports subject to state financial accountability and audit frameworks. Well, apparently Royal North Shore Public Hospital, they just, whatever they want, they get. Westmead Public Hospital is a shambles. It's been like that for 20 years. Very bad culture. Anyway, I'll go in. Maintaining effective communication with local and state public health stakeholders. Well, communication, eh? Yeah, I know who they're communicating with. Anyway, I'll introduce you to the board members. Firstly, Mr. Richard Alcock. He's the chairman. His letters after his name there. LLB. A Bachelor of Commerce from Unswa University. Richard joined the board of Richard Alcock. He joined the board in August 2016 after 5 years as deputy chairman, the chairman of the Finance and Performance Committee of the Children's Hospital. Yeah, I bet you save some money there. I mean, it'll cut some money there. Prior to his appointment, he was director of... this is a good one. In 2017, he was appointed vice chairman of the Bank of America. Merrill Lynch. Yeah, see? Starting to get the picture. The government made Westmead Public Hospital into a corporation and body corporate. And, I believe it's going to be sold like everything else they've sold. The Medicare's just been run down into the ground. And, I'm not saying Labor's any better. They're not the same as the old days Labor. And he was previously the Manager Director, co-editor of Transport Infrastructure, Power Utilities at Merrill Lynch. Power and utilities, eh? Well, the government sold all them off too. So I wonder if Mr. Alcock knows anything about that, whether he assisted. Who knows? Oh, that was from 2007. Formerly a corporate lawyer for 25 years with Alan Arthur Robinson in Sydney, Singapore, Jakarta. Was a senior partner, head of governance, chairman of the ethics committee. Well, that's good to see, ethics committee. He's also director of Unzwa Foundation Limited and Art Exhibitions, not-for-profit company guarantee established to bring major art exhibitions in partnership with State. Yeah. Got his fingers in many pies here. Must be very well connected, Mr. Alcock. Ignoring complaints about Westmead Public Hospital, dying patients, Dear, oh dear. How much do you get, does Mr. Alcock get paid a year? He's there, by the look of it, joined the board 4 years ago, and the place is just absolutely hopeless. Nothing done. 20 years of bullying culture, malpractice, on and on. Anyway, I've got to fly through these. He was awarded the Office of Order of Australia, AO. Well, they don't hand them out freely to anybody. So he's obviously well connected there, and I don't think he would have earned it for his efforts at Westmead Public Hospital. Not from what I can see anyway. If Mr. Alcock, has got anything to say, or he thinks we can substantiate any mistakes in the channel's content, I urge Mr. Alcock to substantiate them in the comments section, and if they substantiate it, of course, we'll do a correction to uphold the channel's rightness and credibility. A good thing, Mr. Alcock, to do, I would think. Anyway, Richard's Award. Yeah, you got the AO for distinguished service to the community, particularly through health management roles, and to the law corporate governance and higher education organisations. Eh? Well, good luck, Richard. You've done well, mate. I don't know who nominated you or who pushed you along, but anyway, we'll move on now to the deputy chairperson or chairwoman or whatever they want to call it these days. This is Ms. Loretta Di Mento. She's the deputy chair. She got letters after her name, Bachelor of Commerce, CA, GAICD. Loretta brings experience in corporate governance, risk management, finance and corporate reporting. She's a qualified chartered accountant. Well done, Loretta. And a graduate of the Australian Institute of Company Directors. Has over 25 years experience in audit and accountancy. Well, maybe Rebecca could order the what's happening in Westmead Public Hospital. Why it's such a shame. Do a big audit there, Loretta. Through this work, Rebecca has developed a thorough understanding of the challenge, opportunity, service trends, emergency risk. Well, emerging risk. She hasn't seen the emerging risks happening for 25 years at Westmead Public Hospital. Anyway, it really goes on. You know, don't believe the spiel. Just look at the reality of these people, what they're doing. Since 2018, Loretta has roles on boards and audit committees in not-for-profit sectors. Oh, that's very charitable, isn't it? And for the state and Commonwealth governments, including an audit committee, member for health infrastructure, formerly an audit partner with Ernst & Young. It's been provided specialists, and it goes on. And her experience extends to post-merger. Oh, this is a good one. Her experience extends to working with entities in significant states of change, including start-up, post-mergers. Oh, I wonder if post-merger sounds interesting. An active coach and mentor. Have you been coaching the Chief Executive, Graham Law, and General Manager, Rebecca Tyson? Loretta led diverse teams in all her roles. Well, you know, the diverse people in Westmead Public Hospital developing their talent, her teams. And it doesn't look like it's been used. They've been doing it at Westmead Public Hospital. Anyway, I'll move on. But you can see how they've been hand-picked, these people, as I move along, by Brad Hazard and Glarus Berejiklian, etc. I don't like to say etc., but I haven't got time to keep talking more. Anyway, we move on to Mr. Andrew Bernard. Yes, Andrew, hey. He's got all the letters: Bachelor of Science, Sydney, MPH, SID, Grad, Cert, BA, Exec, Monash, Mount Elizabeth, MAC, ICD. Us dumb Westies, we don't know what all that means, MICD, but anyway, Andrew might like to tell us in the comments section. Andrew has been a resident of Western Sydney since 1977. God, I thought he'd be with all the other plonkers living over near where Gladys and Brad is, or somewhere over there. Anyway, he's had senior points include General Manager of Bowral and District, Fairfield and Bankstown Lidcombe Hospitals. I wonder if he was at Bankstown Hospital when they killed that baby and put the hoses in the wrong thing and give the baby the wrong gas or oxygen, whatever they call it. Or give him oxygen, I don't know. Anyway, I wonder whether Andrew was there. Maybe let us know in the comments section. Anyway, Bankstown Lidcombe, General Manager of Clinical Service at the former Sydney Southwest Area Service, Director of Operations at the POW, Prince of Wales, Sydney Hospital from 2007 until his retirement in April 2013. Oh, well, congratulations. Good retirement. I wonder how much you'd be on good money there as, on the board. How much they pay per annum there. Anyway, maybe someone could let us know about Andrew's experience as a non-executive director since 1996. He's granted Seeker services, blah, blah, blah. New Prince of Wales Foundation. Yeah, well, obviously Andrew's the type of guy that Brad Hazard and Premier Jicklian want, because, it doesn't say when he was appointed to the board, but it doesn't look like Andrew really cares much. None of them really care much by the look of things, but if that's not the case, please Tell us why in the comments section. We move on to Professor Michael Edeye. I think it's Edeye, sorry if the pronunciation's wrong. Spelled E-D-Y-E. Anyway, we'll move on to Michael. Oh, look at his photo. He looks like Brad Hazard's brother. No offence meant there, Michael. Michael is a Director Division of Surgery and Anaesthetics at Blacktown and Mount Druitt Hospitals. Oh, you should know everything, Michael. You don't answer the patient's complaints, it appears. Pioneered in laparoscopic surgery. Michael was recruited at the Mount Sinai Hospital in New York in 1993, where he practiced there for 20 years, establishing the new discipline. Well, geez, the microscopic surgery that I've experienced and other people have at Westmead Public Hospital, not too crash out, Michael, so maybe you could give him a few pointers what to do. Yeah, he must be pretty good to work in Mount Sinai Hospital. Yeah. Did you work at Johns Hopkins Hospital, Michael? He worked as National Advocate for the American Medical Association and US Medicare in the areas of surgical coding and reimbursement. US Medicare, well, it looks like now you're working, to privatise Westmead Public Hospital, selling it off. Maybe you could let us know in the comment section, Michael. National Advocate. He returned in 2013 to Australia, chairman of the Surgery and Clinical School at West Sydney University. I bet you teach them well out there, chairman out there. All right, yeah, okay, we'll move on to Professor Donald Nutbean. Yes, Donald's got PhD, FFPH from the UK. It says here Don shares his time as a Professor of Public Health at the University of Sydney. Oh, yeah. Well, there's quite a few people there from Westmead Public Hospital at Sydney University, senior advisor to the Sachs Institute and with health partners. It's, these days it's the Vice-Chancellors, it's pay to play. They just get the degree as a given. That's, that was on the ABC, Four Corners, everywhere, common knowledge. Oh, excuse me, yet, yes, Michael's there, and you've also got Professor Adnan name escapes me now, Adnan Nagriel. He's Professor Sydney University, teaching the kids what to do. Do it my way. He's not very holistic by the look of things, not like Westmead Public Hospital Cancer Centre. Acupuncture there, massage, everything, what's going on, and treat you there like a human being. Professor Adnan is telling this patient of mine, for half an hour, look, if you don't take this Volfox chemotherapy, you're going to be dying next year in months. This is towards Christmas last year, and this dying man, the chemotherapy that Nagriel put him on last time was an abject failure, utter failure, and as with the radiation treatment, it damaged the organ so much, the bowel. The surgeon there, Dr. Nimalan Pathmanathan, from outside, private, comes in and does a bit of work there, a fair bit. He's, pretty special, I think, there. But anyway, he told the patient, look, when he first went there 6 years ago, so he said, look, first appointment, I'm reiterating this first appointment, he said, no, we'll just cut it out and you'll be good in 6 weeks, as that's what his GP said to do. The next appointment, everything changed. He said, the team has decided to attack the cancer aggressively. The poor man, he's trusting these people. He said, why is that? And they said, to stop it coming back. Naturally, no one wants it to come back. Yeah, cool. Anyway, after all the treatment, they said, you're cured. And then the cancer come back worse than ever. Anyway, here we got, Nagriel telling this dying man, look, you got to take, if you don't take the Folfox, you're going to die. No one wants to die, But anyway, the dying man, he said to Professor Nagriel, he said, he's thinking to himself, well, it didn't work the last time, all this treatment you told me. And he said, well, if it was you or me, my position, would you take this chemotherapy? And he's fully expecting Nagriel to answer, yes, of course I would. I don't want to die. But he didn't answer that. He said, probably. And, the dying man, he was staggered with that answer. And he said to the young oncologist there, I think her name was Emma, but I could be wrong. He said, well, how about you? What about you? And she's sort of sucking up to her boss, otherwise she'll get the boot by the look of things. That's how they work. She said, probably, concurring with that. Anyway, dying man, there's something doesn't gel here. So he done his own research about this Folfox chemotherapy. In the UK, he was looking at cases there where, it can kill you on the first dose. Serious damage to your organs, mind, and you're never the same person. People have had it. It gives the Folfox chemotherapy gives them another cancer in the blood. And people have taken the chemo regimen for 6 months, like Nagriel wanted this patient to do. And after 6 months, it doesn't work. 6 months of hell. Goodness me. And look at Apple's Steve Jobs. Billionaire. Money coming, probably very wealthy man. He got endocrine cancer. He's got the best research in the world. Endocrine cancer, recommended treatment. In America, there's about 30,000 cases a year or more. Recommended treatment, chemotherapy and radiation therapy. Poor Steve, he done his research, not stupid. And obviously he's seen, that it's a failure. Doesn't work. Anyway, Patrick Swayze, he had, I think, pancreatic cancer, and, the oncologist said, well, look, take 12 months of chemotherapy and, by the sound of it, keep your fingers crossed, Just it's never going to work from the start. Everyone knows that. And anyway, poor Patrick, he said it was hell on wheels for 12 months taking the chemotherapy. Dear oh dear, the chemotherapy, you got mustard gas, made it out of mustard gas. Does that make any sense? to pump mustard gas into your bloodstream. Kills your immune system just when you need it to be strong and fighting for you. Destroys the immune system, lose your appetite, everything. Just what. And there was a Journal of Oncology survey, and they published it. They said over a 12-year period of studying, chemotherapy didn't work 97% of the time. So you do the math. Why are they using it? In this report, or you can do your research. Some people are saying that oncologists are getting a bit of a reward for using it. And Westmead Public Hospital, the dying cancer patient refused to give him medicinal cannabis. They're pumping, want him to drown in narcotics, heroin. Goodness me. What would you prefer, narcotics or medicinal cannabis that does a good job? Helps even with the cancer spread. Improves the mood. The pain. Quite often the narcotics don't work, too slow. So I expect people to go and buy it off the street from some drug dealer in the local pub. Dear, oh dear, this man's written letters to all of the above. It didn't even respond. They got all precious, They didn't treat him with any respect, and told him his complaint was, basically all in your mind. What are you talking about? You got good treatment, dehydration. Didn't show any respect. So he wrote back to him with all due respect. And this movie about this Westmead Public Hospital is also with all due respect to the above mentioned. There's no due respect, okay? You people are dangerous. People are dying. That's what it appears to be. If you think it's any mistake in the content, again, just substantiate in the comment section, and when substantiated, the correction. Okay, yeah. So So anyway, I'm just want to sort of fill in the gaps a bit here. Anyway, here's Michael Nutbeam. UK Health. Surely these people, check up on what this poison does. They wouldn't take it themselves, like Dr. Nagriel and Emma. Another oncologist, he told me, he said, chemo's rubbish. He said, that's all we got. See, that's the line they push to these young doctors. Anyway, we'll go on to Professor Professor Diana O'Halloran. Oh, she got an AO too. Oh, well done, Di. That's what it says here. Di is a general practitioner with a long-standing involvement in primary healthcare reform. Well, why don't you reform the Westmead Public Hospital, the corruption there? It appears to be. Primary long-standing corruption, development of new service and care models, including Health One, connecting care, integrated care. Well, that's interesting. Oh, very interesting. Di chairs West Limited. Ah, very interested. Incorporating the Western Sydney Primary Health Network. Ah, tell us more about how it goes on with the LHD to improve community needs. I can't see any improved in the needs. It's just all bad, Di. What you've been missing in action or something? integration of care across the community. Oh, yeah. Di is a conjoint professor in the Department of General Practice, Western Sydney University. Oh, maybe teaching the young kids well, wouldn't you? At the university. Associate Professor, Sydney University. Oh, you probably know Dr. Nagriel and that other doctor that was infamous doctor in the neonatal unit, ICU. The one that was appeared to be bullying that great doctor, Dr. Michael J. Cole. He's there working with you. Have you been getting any tips from, I think his name was Professor Mordi. You know, they probably all go and have a glass of wine in the Vice-Chancellor's office and some snacks. Good gig if you can get it, but you got to be mates with Brad Hazard and Gladys Berejiklian, it seems, to get these sort of cushy jobs. And anyone who sort of goes against the grain, you're not going to get work here with them. That's what it looks like. Yeah, past chair, general practice, National General Practice Education Training Board, Australian Medicare Local Alliance. Well, you might be able to confirm that why Medicare has just been run down to the ground. Di, seem to be well connected. You'd know what's going on. All of you would. Medical education. Yeah, well, congratulations, Di. In 2018, she's awarded the AO, Office in Order of Australia, for her distinguishing service to medicine in the field of general practice through policy development and health system reform. Well, maybe they didn't know what you were doing, you know, because from what I can see, the reform at Westmead Public Hospital is highly undesirable. But I might be wrong, or, you know, the channel in the context, if you think that's the case, Di, you know, please substantiate it and a correction will be made, happily. Okay, we move on now to Adjunct Professor Mick Reid. Oh, Michael's got an AM too. Oh no, AM, not an AA, yeah. Well done, Michael. He looks a jovial sort of bloke, big smile there. Good on you, Michael. Mick has undertaken many roles in the Australian health system during a career that spans 4 decades. Wow. He must know everything. His experience includes bureaucrat, consultant and academic, giving him a breadth of experience, depth of knowledge of the Australian healthcare system. Well done, Mick. Mick was Director General of Health in 2 Australian states for 5 years until 2002. He held the position of Director General New South Wales Health until 2011. He spent 3 years as Director General of Queensland Health. Well, Michael, that's very impressive, mate. Mick, were you there? Were you the Director General of Queensland Health when infamous Dr. Jayant Patel, surgeon from India, was working there? Apparently he killed 100 people, maimed many others, destroyed lives, and many people, as I understand, complained to the hospital like they do to, you know, about Westmead Public Hospital, which all you people are presiding over. They complained to Bundaberg Hospital, and their complaints are just fobbed off, like at Westmead. You know, if the complaints were actioned, it would have saved many lives. Anyway, this Dr. Patel, he just packed up his bongos and fled Australia. What do you think about that, Mick? Were you there, mate? Let us know if you were. Okay, we've got to move on quickly. Here's the next one. Dr. Keith Hartman. He's got an AM too. I've always thought they were hard to get, these AOs. Anyway, Dr. Keith Hartman. Keith had a 40-year career as a specialist obstetrician and gynaecologist working in the public and private sectors. Well done, Keith. Geez, he got that funny, that mysterious smile that Brad Hazard. He almost passed for Brad Hazard's brother. Anyway, he's a consultant with emeritus obstetrics and gynecology at Royal North Shore Hospital. Well done. Well, you know Brad very and Gladys well, and Trent Zimmerman, you know them well. I think you would. You should. It'd be a miracle if you didn't. Tell us in the comment section if you do know them. Because they don't pick any Dumbo for the job. They get to pick the person, the man that they want, or woman that they want, to do the job, that they desire. Anyway, Associate Adjunct Clinical Associate Professor, Sydney School of Medicine, University of Notre Dame, Australia. Dear, oh dear. Dear, oh dear. What's the place come to? He was a director of Mater Hospital, North Sydney, in two major redevelopment programs, and is chairman of Friends of the Mater Foundation, which has enjoyed considerable success in fundraising. Well done, Keith. Perhaps you can organise for this dying cancer patient that's been blacklisted from Westmead Public Hospital, to go over to your hospital, Royal North Shore Public, and, where he'd be treated properly. Keith, there's over 400 excellent comments for Royal North Shore Public Hospital, mate. Westmead Public Hospital, see you later. It's a hellhole. Worst hospital in Australia, as some patients put it. And I wouldn't disagree with any of that. Anyway, you got a strong Keith's got a strong commitment to teaching future generations of doctors and advocating for the delivery of high-quality patient-centred healthcare to all, especially the more vulnerable sections of our community. Really? Well, that's pretty heartwarming comments, Keith. But it doesn't seem to be happening in practice. Anyway, let us know in the comments section. Keith, okay, we'll move on now. Here's another one. Adjunct Professor Deborah Toms, THOMS. She seems a jovial sort of lady. Looks pretty senior with a lot of experience. You'd understand the hardships of aged people, you would think. Anyway, it says here. Hang on. No, I'll read out. She's got all these letters. RN, RM, BA, UNSWA, MNA, UNSWA, Grad Certificate, Bioethics, UTS, Dip Arts, UNE, Arts degree or something, FASCN, DLF, FHCHM, Honorary Wharton Fellow. Well, congratulations. Jeez, you must be very brainy. Have a lot of brains. She likes to be called Professor Deborah Toms. Highly experienced healthcare manager and leader following a career in nursing, health department management, health management, nursing leadership over 35 years. Deborah is the immediate past Commonwealth Chief Nursing and Midwifery Officer at the Department of Health. You'll have trouble reading this out. I feel like bloody throwing up. Deborah has gained broad managerial clinical experience during her career. She has worked as a clinician in remote Australia, held managerial positions. They have included General Manager of Royal Hospital for Women in Sydney. Jeez, well done. Very great talk there. Resume, or what do you want to call it? Then Macquarie, here we go, CEO of the then Macquarie Health Centre Service in New South Wales. CEO, eh? Oh, a bit like Graham Loy. Chief Nurse and Midwife in the Health Department of South Australia, New South Wales, was appointed in the inaugural CEO of Australian College of Nursing. Internationally, Deborah has represented Australia on the Executive Board of the World Health WHO. She's represented Australia there. Dear, oh dear. You know, and dying patients, this patient I know, and lots of others are complaining. Complaints about Westmead Public Hospital, they've been fobbed off, Deborah. Been fobbed off. They complained, this dying man complained to you. He sent letters to all the board, ex officios, Premier, Berejiklian, Hazard, and they ignored his letters. He wrote with 2 years old with due respect, which was none. Don't deserve any respect. And kept ignoring him. Probably written 20 letters. You know, you're probably agreeing with Dr. Mee Ling that this bloke's a bloody nut job. It's all in his head. He's got mental health problems. He should be put into Cumberland. Is that what you think? Let us know in the comments section, Deborah. Completed a nursing education, Prince of Wales, POW, and a midwifery at the Royal Darwin Hospital in Northern Territory. Sounds good. Also hold a Bachelor of BA. What's that? Bullshit artist in economics and psychology. A Master of Nursing Administration. Well, gee, I tell you what, Deb, you want to go and check them out there in Westmead Public Hospital about the nursing administration. You know, I could talk for 2 hours about this, but, you know, I've got time constraints, so I want to wrap this up as much as I can now. Still got a bit of gunpowder being kept dry. Complete general nursing, blah, blah, blah. Deborah has a particular interest in leadership, organisational culture, and the career decisions of senior nurses. If they say anything wrong, they get blacklisted or the boot. Is that the case? Seems to happen there a bit. And sitting here, Distinguished Life Fellow of Australian College of Nursing, Honorary Fellow of the Australian College of Health Service Management, in recognition of a contribution to nursing and healthcare. Geez, Deb, you got your fingers in the pie everywhere. I don't think you got much time for Westmead Public Hospital. Do you live over near the Royal North Shore Hospital? Let us know in the comments section. Anyway, well done, Deb. Anyway, we move on to the ex officios. Ex officio board members participate in agenda terms relating to areas of expertise. Yeah, they ignore patient complaints, blame the patient, the ex officio, like Mr. Loy. You know, nothing to see. Same with the general manager there, Rebecca Tyson. That's what it looks like. Appears to be that way. Anyway, I'll give you I'll give you a rundown on the chief executive. Look, you can go through all these on the internet there, where they're all there. You know, keeping the pretense up. That's what it looks like to me. You be the judge. Anyway, over the last 12 years, Graham has held a number of executive roles, chief executive for NSLHD. His knowledge of both clinical and corporate service includes a strong focus on system performance through healthy relationships. Well, is that with all of the above mentioned, Graham? You're not having healthy relationships with, patients that are very sick and dying, seem to be just fobbing off their complaints. You people are all, you have a duty of care and obligation to reply to their complaints, even if you see it as not with due respect. But in fact, they are replying with all due respect, and that's none, Graham. Anyway, Graham has accumulated significant experience in all aspects of the leadership in both the public and private sectors. Yeah, bullshit baffles brains, Graham. He takes great pride being able to deliver highly complex clinical services through high-performing teams. Where's that? From your office upstairs somewhere and on the phone. Let us know, Graham. We appreciate it. His breadth of knowledge spans facility, district, statewide environment, enables him to couple strategic direction with a broad improvement in research goals, including ensuring optimal provision of safe, high quality and timely clinical services. I'll repeat that. He's responsible, his goals, research goals, including ensuring optimal provision of safe, high quality and timely clinical services. In concert, I don't know if that's in concert. Let us know anyway with the needs of the community and the health system. Graham, mate, it's not happening. You know that. So what are you saying this for? Who do you think you're fooling? Please, mate, make a comment in the comment section. And he says, patients are our principal focus. Graham's his principal focus. Graham strives to support New South Wales Health. I'm nearly choking saying this. To deliver high quality care. And a simple motto for each discussion. Claiming and telling saying to all these employees, what if it was your mum? Yes, I say to you, Graham, what if it was your mum? And they got the treatment here, mate. You wouldn't take them to Westmead Public Hospital. You'd take them over Royal North Shore Hospital. You'd have to have rocks in your head if you took them to Westmead Public Hospital. Anyway, here we go. Move on to another ex officio very quickly. Mr. Barry Mitrevsky, Director of Finance. Oh, he's a bean counter, Barry. Bachelor of Commerce, Economics, Diploma Accountancy, MBA, CPA. Appointed in July 2018, Barry brings strong governance and rigour to West LHD's financial strategy and operational management. Completed tertiary at Wollongong and he holds a Master in Business. He's also qualified CPA. Well, Barry, he sounds like just what they need over at Royal North Shore Public Hospital and, go and study there and bring it back to Westmead Public Hospital and do the same, Barry. More than 35 years experience in financial oversight, including, there's a financial oversight with, appears to be with Westmead Public Hospital, Barry. He says oversight including 30 years with New South Wales Health, predominantly with Illawarra Shoalhaven LHD. Well done, Barry. He has worked with all levels of New South Wales Health, understanding the needs of business, and Gladys Berejikli and Brad Hazard. He understands their needs, providing what's needed. Is the basis of his strategic and operational approach. Yeah, well, you can see that's how you're doing it, Barry. Let us know in the comments section, mate. is driven to ensure WSLHD is financially sustainable. Well, well, financially sustainable, to deliver the best available healthcare for people of Western Sydney. Come on, Barry, who do you think you're kidding, mate? Why don't you take your family and yourself to Westmead Public Hospital and get some treatment there, mate? Go and see Dr. Mee Ling and Dr. Chris Cheeseman, mate. The nurses, they'll look after you, pal. Anyway, we move on. He's got Dr. Mark Priestley. Oh, yes, Dr. May, chairman of the Westmead Medical Staff Council. Well, got a bit of status there, Mark. MBBS, FANZCA. It says here, I'll call him Mark. It says Dr. Mark Priestley is the head of the Department of Anaesthesia and perioperative medicine at Westmead Hospital, Public Hospital, with particular interest in cardiac and anaesthesia and medical education. Well, Mark, you want to get down to the emergency section and liaise with Julia there, because what I understand, people, can have heart attacks there dying from waiting. So, get down there, Mark, and check it out, mate. I don't know how many years you've been on the board, but it seems like the board is bored shitless. Yeah, right, yeah. And final fellowship examiner, including chairman for 2 years for 12, chairman for 2 years for 12 years. Anyway, you read it yourself. There's a member of the WSLHD Clinical Council, the Westmead Clinical Council, the WSLHD End of Life Care. They're leaving dying patients for dead with months to live, blacklisting them, Mark. You happy with that, mate? Refuse to give them medicinal cannabis, want to pump them up with bloody narcotics. Instead, do you agree with that? And various committees for current Westmead redevelopment. Pardon me. Yes, my long-haired assistant making a cup of tea. Anyway, end of life, come on. Committees for current redevelopment. Yeah, glossy new buildings with the same old rubbish going on inside. Mark, did you know, you would have known, you've been hanging around that long, you would have known of Dr. Michael J. Cole. He was bullied there at Westmead Public Hospital for 10 years. Let us know what you know about that and how come it's still going on for 20 years, this nonsense. Okay, we move on to Dr. Emma McChaon, McChaon. Okay. Executive Director, Medical Service, Emma. Hi, Emma. Emma was appointed at Western Sydney Local Health District Executive Director, Medical Service in March 2009. Well, you've only been there a couple of years, Emma, but look, come on, open your eyes, take the blinkers off, Emma. She oversees the medical workforce, oversees the medical and clinical service across Western Sydney Local Health District, ensuring high-quality person-centred care through the provision of clinical excellence and best practice. Congratulations, but it's not happening. Anyway, I've got to wrap this up. I'm running out of time here. Develop project at Westmead. Come on, Emma, who are you trying to kid? Tell us about in the comments. Emma's been practicing as a paediatrician for almost 15 years. Grad certificate. Well, Emma, you probably know Dr. J. Cole there was bullied for 10 years. Tell us in the comments. She worked in both clinical and managed, also medical. Look, I've got to stop reading. Health education. I feel like choking. Ms. Caroline Farmer, Director Nursing, Midwifery, Clinical Governance, RN, Coronary Care, Certificate, Bachelor of Health Services Management Office Institute, goes on Western District. She appointed in 2009. Carol joined the Ministry of Health, where she was a director. All this, well, I can't read anymore because the bullshit's, it's breathtaking, Carol. And look, let us know in the comments section why you're not doing your job and answering the letters of dying people, ignoring them. Carol has experience with healthcare professionals, have held senior management roles in public health care, has clinical governance, patient safety, leadership management. Oh, who do you think you're kidding? Let us know in the comments. Here's the last one, and I've got to get out of here. Executive Director Operations, and it goes on. Alison's Executive Director Operations, Western, blah, blah, blah. Is a graduate in New South Wales, where she received Bachelor of Social Work. Social work, we know what they're like. Alison has completed postgraduate studies in public administration and completed her degree in health service management from Tasmania University, like Graham Lloyd. G'day, big shout out to all you guys I know down in Tasmania in the Royal Hobart Hospital. Alison has extensive experiences leading and managing complex organisations, most recently General Manager of Campbelltown and Camden Hospital, where she was responsible for the 700 million capital redevelopment at the Campbelltown Hospital. I wonder if Campbelltown Hospital is a hellhole too. Anyway, I got to pack up me bongers. Ciao, guys. I hope you learned something. Have a great day.